A new government study is focused on helping define long COVID. The research is part of the National Institute of Health's billion-dollar Recover Research Initiative, which aims to define long COVID, understand what causes it, and develop treatments for it. Joining us now to talk more about this and other health topics is Dr. Jeff Pothoff, UW Health's Chief Quality Officer. We always love having you along on Tuesdays. When it comes to this long COVID study, I think the biggest thing that jumps out at me is the fact that so much money and so much effort is being spent on something we don't hear of that often. How prevalent is long COVID?
You know, it's actually pretty prevalent. I think, folks that have it, sometimes they just shrug it off as other things. I'm always tired, maybe I'm getting older, something else going on. But for folks that have had COVID, a good number go on to get long COVID ultimately in the end and have some of these symptoms identified in the study.
Are there specific tests that you can take to determine whether or not you have long COVID?
I think that's what we'd like to get to, either a specific test we can take or specific constellation of symptoms that would define someone as having long COVID or not having long COVID. This initial study does a good job of kind of categorizing the symptoms that individuals are having, be it dizziness, loss of taste and smell, fatigue with exertion, some abnormal movements, but doesn't give a lot of specificity to it or what it would take to define someone as having long COVID versus not.
Interesting. It's like, well, if you fall into this column and you check off so many boxes in terms of the symptoms, perhaps you have it. But really interesting that they're spending a lot of time focusing on this. Speaking of treatment options, Paxlovid kind of has been the go-to treatment option after contracting COVID-19. But now the FDA is giving its full sign-off on its prescription. Should everyone be seeking this if you do test positive for COVID-19 now? And how effective is it really?
Yeah, I think, as it pertains to Paxlovid, it's a pretty good medication. Now, it's most effective in folks that would have risk of having severe disease. So underlying medical conditions, those at the extremes of age. The approval today, full FDA approval, is for the adult dose. It's still available under emergency use for pediatric dose. It does a pretty nice job of preventing hospitalization, maybe 80% reduction in the need to be hospitalized in these high-risk patients who get on Paxlovid within that window that reduces severe disease. So I think, yeah, if you get COVID and you're at high risk, Paxlovid is not a bad option.
And the FDA is saying it's safe, go ahead, we got to give it the green light. I want to spend the last minute here talking about this fascinating study out of Boston Children's Hospital and Harvard Medical School. They looked at babies who died from SIDS, or sudden infant death syndrome. And they think that there may be a correlation between SIDS and an abnormality in the baby's anatomy. Tell us what this abnormality is, and is there a way to kind of use this information for more proactive approaches to infant safety?
Yeah, this is a really interesting study. So basically what they've done is they've looked at infants who passed away from sudden infant death syndrome, and they've tried to identify some factor that might be unique amongst those infants that isn't necessarily common in other infants. And what they found in a certain part of the brain stem called the medulla is, absence of a certain gene that helps with production of serotonin. And this is interesting because physiologically, serotonin is one of the hormones that helps us gasp for breath or kind of wake up when we're not getting enough oxygen. Therefore, it would make sense that infants that don't have this may be more susceptible to sudden infant death. The bad news is there's no way to test for this while the infant is alive. So we can't necessarily know who has this and who doesn't. Goes back to just safe to bed practices, laying an infant down on their back on a solid surface, not a lot of loose clothing or blankets that they could wrap themselves in. And then the idea that we don't want folks co-sleeping. Good for infants to sleep in the same room as their parents, not a good idea to sleep in the same bed.
Always great proactive approaches that have been around for a long time, but very, very interesting between this correlation. Dr. Pothoff, we always appreciate it. Thank you.